Adam, nice seeing you again.
It's great to be back.
We will talk about the book, and you, together with Chaim Weinberg and Aaron Rolnick, you are one of the editors, right?
That's right. Yep.
So
the
let's
book's
start.
actually coming out on the 30th of December, 2022, so in a month or so.
Perfect. So let's start maybe from the question, what was the idea actually of the continuation of the mentioned Theory and Practice of Online Therapy book published 3 years ago?
Okay. Well, actually, it started by examining, is it time to come out with the second edition of the original book? And the book came out in 2020, just as COVID broke out. And our conclusion was basically there's just so much more information as a result of the sudden adaptation or adoption of online therapy, that it justifies, in fact, a new book and starting from a different place. Now, the first book starts a lot of practicalities, ethics, and I would say somewhat more basic elements. And we really want to build on the experience and knowledge that has been gained over the last 2 years.
And the subject of online therapy, the idea behind the first book, how does it actually started? When, for how long actually the therapy based on video connection is already present?
Okay, well, that's actually two questions, because online therapy or teletherapy has been around for quite some time. It started in the 80s and 90s, text-based and bulletin boards and telephone. But the real breakthrough, in my opinion, is really in the last, I would say, is 7 or 8 years, since around 2015, where video has been much more available. Doctors Rolnick and Weinberger have been working since 2001, have published since then many articles about online therapy. So they're really the pioneers in this field.
And how did you join the team of the editors and co-writers, and who also worked on that second continuation edition?
Well, first of all, I was very kindly invited by Dr. Rolnick, who's a colleague, and we work on many projects. During COVID, we worked together, training hundreds and hundreds of different therapists, psychologists, social workers on the transformation, how to work with Zoom, how to work more professionally. And as a result of that cooperation, they kindly invited me to join this great project. And of course, the real hard work, or a lot of the main contribution, is by the tens of contributors who've written different chapters for the books. And these people have come, psychologists and therapists have come from a very wide variety of different types of psychotherapy.
And the people working on this book are coming from different parts of the world, or that was actually based on the studies and work of people only in UK?
No, it's very much a global book. I think that's one of the fun elements. We have people from pretty much every continent, Middle East, Europe, the States. We're missing out on Australia, but hopefully in future books we'll have that as well. So yeah, it's very much a global book.
Perfect. And I understand that continuation, as you've mentioned before, was also kind of needed after the COVID pandemic experience.
Absolutely, yeah. I mean, first of all, the quantity of data produced and of experience and knowledge is huge. If you can imagine, before COVID, we're talking probably about 1 to 2% of therapists who are working with online therapy. During COVID, one of the research talks about 98%. So that's a huge change, a huge transition. And it really was important to try and find out, not just is it possible to work in online therapy, because that was the real question. If we think about 2020, 2019, most therapists would prove to you that it's not possible to work online. It can't work. It won't be there won't be any depth in it. And we passed that stage. And now we're at a stage where not is it possible, but how can we do it better? What can we learn? What are the advantages? What do we need to learn to do different? So we're really coming from a different place now.
What were actually the main reservation?
It's a really important question, and maybe we'll add on to that a bit later. I think the reservation came from a couple of places. Partly, it's an emotional challenge. People have a lot of very strong, or had a lot of very strong feelings about this idea of doing things through technology. So there's a very emotional aspect, and there are a lot of very good explanations why not to do it. The lack of bodily presence, which might, and a lot of people presumed, would prevent any real intimacy, any real connection between the patient and the therapist, which is one of the most fundamental parts of any psychotherapy. So a lot of people assume that without a strong connection, and you can't have a strong connection if it's facilitated by technology, then it can't work. We have even a chapter that starts off by explaining how the author was sure it is not possible and came out to prove how it's not possible, but COVID forced him to try it. And now that forced him and us to re-examine a lot of our paradigms and a lot of our assumptions.
So who is the online therapy actually suited to? Which type of patients is addressed to?
Okay, well, that's also very interesting, because initially, and I think even the first book we talked about it in a bit more cautious manner, saying it not for suicidal patients and not for post-trauma. Those were sort of, it was a commonly acknowledged that you can't have any of these more challenging situations. And we have chapters talking about working with post-trauma, and we have chapters talking about working with children. We have people working with the elderly. We have people working with patients who have suicidal thoughts. So I would be cautious to say almost anybody. And we haven't found a clear category of people who we can actually say it won't work for them. I would say that it is a lot up to the therapist. And that's something we found. One of the key influences on the successful online therapy, and maybe I'll elaborate on that in a minute, is in fact the therapist himself or herself.
So basically, therapists using different type of methods or school of therapy can use safely the online therapy.
Yeah, and again, that's one of the things we really. You asked me if the book is global, so diversification and having lots of different approaches was really important to us. We tried to get representation from all major aspects, all major modalities. And you'll see psychoanalysis and psychodynamic approaches and art therapy and even play therapy. And we found that every modality can be potentially transformed to work online, and there are advantages and disadvantages. And each chapter talks about, we have a group of chapters talking about how to take the different modalities and adapt them to online work.
Helping Hand is a platform which offers online therapy. We specialize in that, and some of our potential clients, they have reservation towards how to actually a therapist can create the safe setting during the therapy.
There are a lot of different aspects to create this feeling of safety, of intimacy, to create a real relationship. The patient-therapist alliance, as I mentioned before, is crucial. And it starts from very, very technical aspects. The therapist needs to feel comfortable with the media. He needs to feel comfortable working with the different buttons. We coined a phrase we call psychotechnical. If the therapist knows how to use Zoom and feels comfortable and isn't concerned, am I going to press the wrong button, then he will be more present. If the therapist is very involved and very worried about what do I have to do now and what happens if I press the wrong button, then he won't be very present. And that will have a strong impact on the setting. And it can be from elements such as having a separate microphone, so you can sit at a distance, so you can actually see, just as you can see in my case, you can see my hands, you can see much more body. As the body isn't physically present, but there are certain aspects we want to bring in. So if the therapist knows how to sit at the right distance and talk to the patient and make sure he's also at a comfortable distance so we can see each other clearly and really get as much as possible of non-verbal communication present. If the therapist knows how to talk and bring up the body, often I won't be able to see clearly exactly how you're responding. I can't see now your hands, but I can say to you, I noticed you're moving your head. And how does that feel? And what does that tell me? And I even smiled as I responded, as you responded. And that's bringing our body back into the, thank you. That's really bringing the body back into the session. And that helps build our feeling of intimacy and it helps compensate. So that's another aspect. We found that, and that's an interesting point, therapists jumped into this boat together with the patient. A lot of therapists and a lot of patients found this a new experience for them. And when the therapist was able to openly discuss with the patient the difficulties and their reservations about working online and how they feel, and maybe they even have a certain degree of hatred towards the camera. But if we can talk about these things and we can share the difficulties, and if the connection drops in the middle of a session and the therapist is even willing to explore this experience together, then we're creating a totally different setting. And we're able to create a feeling of intimacy and trust. And that's what we're really aiming for. And there are a lot of different aspects, and they're described in detail in the book, of the different parts of intimacy and presence and the therapeutic alliance. But there's a lot that therapists can do to really make it an engaging experience. And the word experience is also key. We're seeing that a lot of therapists are making the interaction much more experiential. They're doing things which they hadn't done before. And again, this can help create a much stronger presence, a much stronger connection. So there's a lot of different information and based also on experience, of things that the therapist can do to make the session powerful, meaningful, in many ways just as, and sometimes in certain situations, even more powerful than a face-to-face meeting. So there are actually a number of advantages as well.
So the book is mainly dedicated to the practicing therapists, but also to the postgraduate students who will decide to start their practice.
What I like personally, what is very important to me, is that as the book has tried to cover different approaches, different modalities, it gives us an opportunity to enrich ourselves. So I'd really call out to anybody who's reading the book, and if he's a CBT therapist, don't jump into just the CBT chapter. Have a look at what they're doing in art therapy. See how they bring, how they use the online platform to create a more effective experience, how they bring in intimacy and different elements of therapy. And it's a great opportunity to learn from other modalities and from the practical aspects as well. I think it also gives us a lot of insight about how different approaches work and also the similarities.
During the therapy, I think it's very important to actually read not only to hear the patient, but also patient or client, but also to read the body language. How do you do that in case of the couple therapy, for example, or even maybe a group therapy?
Okay, well, that brings us into...
We're still talking about the online therapy, of course.
Yeah, absolutely. First of all, I'll mention we're also coming out in about 6 months in a book on group therapy. So I'm going to focus at the moment on couple therapy. But first of all, what is common to both is really the biggest challenge, technological challenge that we have at the moment, is that you don't know who the therapist is looking at. Or who a member of the couple is looking at. When you have multiple people on a screen, it's very hard to know who they're talking to. So first of all, we have to take this in account. And once you take this in account, there are very simple things I can do. When we're talking about couple therapy, it's interesting. There are certain disadvantages. I'll give one example. In couple therapy, for example, and we talk about this in the book, most couple therapy situations, there's certain conflict in the background. So we're already starting at a very difficult position, and the responsibilities of the therapist are multiple. And he has to even be able to sort of work to calm down and to help deal with certain breakouts that might be. And that's a real challenge when working online. On the other hand, there are other interesting aspects. For example, some people have found, some couples, and there's quite a bit of research on this, have found that because the couples don't necessarily see the therapist can be in the background when they're practicing conversation, it allows them more intimacy. So this ability to play around with who is visible on the screen can actually be a real advantage. So I can give the couple intimacy for a few minutes. I can actually step out, but I can see what's going on. We talk about in the book and different options. We recommend usually for both members of the couple to have their own computer, but we can also share, and we can think about, and there's not a question of right or wrong, but just taking account additional factors. Do we face each other? Do we sit separately or not? We have the advantage of being able to work on long distance relationships, which is also sometimes an issue. And we found out other additional things suddenly become more relevant. For example, one of the approaches in couple therapy is to try and look at a bigger system, to look at the family. Now, to try and get a family together for a session is really difficult. It's not practical frequently. But once you're online, it's really easy. It's really easy to ask one of the children, can you come in? Or let's have a session with grandpa who's in another continent. So it allows us to work at a system level sometimes, look at the wider family. Another interesting aspect, we're talking about couple therapy, and this is just because of the fact that we're going to be doing it from our home, is that the therapy is happening at the very place where the conflict exists. And this can sometimes be an advantage. And if we're practicing, for example, how to deactivate each other, how to reduce the level of tension, we're doing it in the place where life carries on. It's not at a neutral place. It's not at the therapist's clinic. It's in the very same home where we're going to have to carry out these skills. So this is also an interesting advantage. And of course, there are disadvantages as well. It's not all perfect. There are problems, there are challenges.
That was my actually next question. If we should summarize all the positive and negative aspects of online therapy, how would you do that? Like few pros, a few cons.
Okay. I'll start with the pros. I think one of the main advantages, and the obvious one, is the accessibility. The accessibility from point of view geography. There are people who could not have had therapy in the past. They may live in a village far away. There may be other problems, people who are disabled, and it's physically difficult for them to travel to the clinic. So the accessibility, and of course during the COVID it was very obvious, the accessibility of therapy has increased. One of the biggest quoted disadvantages of online therapy is, in fact, can be a great advantage. The fact that I can see myself, the self-image, which has caused a lot of anxiety whilst using different video conferencing platforms. If the therapist knows how to work with that, it can be a huge advantage. We can practice different things. We can even notice the discomfort of seeing our own image. So there's actually something we've really learned how to use. I can record the session. It's really, really easy to record a session when we're working online. And for couples therapy, that's a great advantage. We can have a look together at our fight. For a point of supervision, for the therapist himself or herself, we can see recordings of the session, of course, if there's agreement from the patient. The transition to enhancing tools, online tools, is much easier. So if I want to bring a video and share something, or use a whiteboard, or use other applications which can enhance treatment, it's actually much easier when we're working online. It's a more natural transition. And even the transition to tools which help resonate, remind us of things we want to do between sessions. I mentioned before, our home becomes the frame of where we're doing the work. And we can actually see this as a disadvantage, but it also can help us internalize things. You know, the place where I'm having the trouble, the place where I suffer anxiety, is the place where I'm also now reframing it in a therapeutic context. So this is also an important advantage. I can even gain insight to my patient's life. Again, if there's agreement, we can look, for example, at the picture in the background. Or maybe during the session, the patient's dog will jump onto their lap, and we can talk about the dog for a moment. And it gives us insight and, again, an increased sense of intimacy, which is very important. I want to very briefly, we'll talk a bit about disadvantages, because there are disadvantages, of course. The fact that the body isn't present is a problem. We're losing part of the information. Even if I move away from the camera, I'm still losing part of the information. I'm not seeing all the body. There are nuances which are harder to see, and that's a disadvantage, and we can try and compensate it. There was thought, and there's still discussion, do we achieve the synchronicity, which is also often related to the intimacy and the alliance. And again, I think we were starting to see that, in fact, even the facial information, which, by the way, in Zoom can sometimes be even clearer than in therapy. We can play around with this. So we're finding actually there is still a degree of synchronicity. There is a digital divide. One of our authors talks about that. Not everybody has a laptop at home. Not everybody has stable internet. And sometimes another problem we found, and that is one of the most severe problems, not everybody has a quiet room at home where they can sit down. So, I find sometimes a child popping into the room, or people even going to their car and talking in the street. So that's a serious limitation. Connectivity can cause problems, and it can be unpleasant. It can be an advantage if we know how to use it. So if the internet was dropped for 5 minutes and we talk about what happened during that time, we can use this rupture in communication as something which we can build on. But it is a disadvantage. There's the issue of resistance, which we haven't examined enough, and we haven't gone into that in the book, but that is something which has to be discussed. Anecdotally, I'm finding a lot of youths have a lot of resistance to working online, possibly during their experience at Zoom at school or video conferencing at school. So that's something which we have to understand, where there is resistance. And of course, it requires training. I think it's a really important aspect. It's something we have to take in account. One other interesting, surprising disadvantage is, in fact, the fact that you don't have to drive, or you don't have to, there's no transport. Normally when we go to a session, it can be tiresome. I might have to drive half an hour to the session, or take a bus or walk, but I have half an hour between the tempo of my normal life and the therapy session. There's a buffer. And one of the things we found in online therapy is people tend to, in the middle of their email, drop the email, go onto the session, have their session, and then run out and cook or whatever, and they don't have the time to process. So that's, again, it's a disadvantage which we can compensate for. We recommend patients and therapists, by the way, give yourself 10 minutes before each session. Give yourself 10 minutes after the session. Take that, plan that as part of the time. It's really important. We need this processing time. So those, I think, cover not all the aspects, some of the main aspects. I would like to say, I think one of the biggest advantages of online therapy is the fact that it's different. It's something which has demanded that we re-examine a lot of our assumptions about therapy. And I think that by definition is a great thing. We've had to revisit what intimacy is about and what creates a powerful session, and what are the main elements. And I think it's doing something good for the world of therapy, psychotherapy in general. So these are the indirect follow-up effects, but I think they're also very, very important.
So I think the last question will be a little bit related with what you mentioned just before about the aspect how to read, for example, face and the expression, etc. And I know that sometimes there are tools actually to use based on artificial intelligence. Can we just mention quickly how could be used during online therapy?
Sure. We have a chapter just in the book just about the adoption of AI and other technologies. And AI is interesting because, as you just mentioned, it can examine a lot of aspects which have suddenly become available when we're working online. Our tone. It can bring in information that as a therapist I might have missed about my patient, and also about myself as a therapist. So AI is bringing us additional information if we choose to use it, examining facial expressions, examining how long am I talking. Just a technical aspect, but I can get a lot of feedback as a therapist. There's a combination of the use of AI with big data starting to look at trends, and to give it can be at the intake level and suggest potential directions. And this can be based on chat, on text, on voice, on the image. So it's helping us prior to starting the work, give us already some information. During the session itself, there's a lot of different things it can bring out. Again, you mentioned the facial expressions. It can look at a session in general. There's a program there which will examine how much you're following, for example, a CBT approach. So again, it's providing, I think, probably the most important thing is providing therapists potentially with a lot of insight. And this is something which we believe will grow. And again, it has to be used with caution, but it's information we can choose to use.
Thank you. We have answers to most important question that first of all, the book the book was built on a lot of practice, but many experts, so it will cover a lot of reservations also towards different type of therapists. Well, I think what we should recommend now is to, especially for the people who practice the therapy and the students, basically to buy this book and to read it, and hopefully it will be also translated in few languages, and people who cannot read in an original language will also use it. Thank you very much, Adam.
Thank you. It was a pleasure being here.